Hi, just checking to see if my audio is okay for everyone. Mic check. One. Okay. I just got the signal that. Oh, shoot. Okay, now I think my mic's on. Okay. I'll just wait a couple more minutes. All right, let's get started, shall we? So, hi, my name is Dr. Melissa Mateo. I'm a naturopathic physician here. And if you haven't seen me around the clinic or met me in person yet, I'm the new resident at Desert Wellness Center. I just like to start off by saying how special it is for me to be joining on here and speaking to you all about estrogen. I'm also so grateful for my amazing team. I've had the pleasure of learning from some brilliant docs who've been practicing for over 20 years now. So thank you all in advance for joining me on this webinar. Little bits about me if you're interested. I have my doctorate degree from Sonoran University of Health Sciences out here in Tempe, Arizona. And so let's get into it. So estrogen. With the recent holidays, I've had a few women from my family or even friends have asked me some questions about estrogen. Some ask, should I get my hormones checked? Um, am I a good candidate for estrogen therapy? How do I get rid of these hot flashes? Because they're crazy. And others are just like, well, do I just deal with it? So if you are a woman who's asked yourself these questions or have been struggling with some of these symptoms, then you've come to the right place. So today I'm going to be spending most of my time on estrogen and telling you all the good things. And while all hormones, deserve the limelight as well, um, I just think today we only have enough time for estrogen, but for a long time now, estrogen has been deemed the bad girl on the block. She's the villain of the story, especially in the realm of hormone replacement therapy. And in the late 90s to early 2000s, there have been some studies on hormone replacement therapy, one in particular that was put out in, I believe, 2002 was published by the Women's Health Initiative, and it was poorly interpreted. For the past 20 years, estrogen has been a highly controversial treatment, and about 80% of women have completely stopped their estrogen replacement therapy since then. And if you haven't seen or heard on the internet for the headlines of the FDA, they recently announced it back in November that they have finally removed the black box warning from estrogen. I see this as a huge victory for my women, especially that now that it will open doors for those seeking for better health and overall quality of life. Now, let's rewind back to the 90s and tell you a little bit on how we got here in the first place. So I will be going back to this slide here in just a moment. But as we see here, this is the black box warning label on estrogen products. This in particular is the vaginal cream. And so with this black box warning, this scared a lot of women from using their estrogen products. It tells you the increase of endometrial cancer, breast cancer, deep vein thrombosis, and the list goes on. However, I'd also just like to point out that there are still some products or medications that are continually prescribed to patients today. And for example, there's antidepressants. Some that you may be familiar with are Cymbalta, Celexa, Zoloft, and those also have a warning for increased risks of suicidal thoughts. Some NSAIDs, for example, Celebrex, which is particularly helpful for pain management. It helps reduce inflammation, but it also carries a risk for causing heart attacks or strokes. Lastly, there's also benzos or benzodiazepam like Xanax, which is helpful for those with anxiety, and other benzos help for muscle spasms. But that also can slowly and severely lower our breathing, and also is carries a warning for abuse and addiction. So my goal was not to stigmatize any medications that have a black box warning. Many of these therapies are medically necessary and beneficial when used appropriately, but also with careful patient monitoring. So as a doctor, it's important that we do know these risks on top of, prescribing them to our patients and seeing what fits their needs the best. Going back to my slide, in this new era, so with going back to those studies about the Women's Health Initiative, there were a number of flaws. I just won't have the time to cover all of that today. However, it's important to remember not all hormonal formulations are the same. So with the WHI, they only studied one specific formulation of hormones, and that includes the conjugated equine estrogen, also known as CEE, and progesterone acetate, which is another hormone. And while there are multiple observational studies prior and showed favorable outcomes for hormonal replacement therapy in postmenopausal women, there weren't any large-scale randomized studies that were available at the time. So then, the Women's Health Initiative was designed to carefully evaluate the risks and benefits to hormone replacement therapy in postmenopausal women. One of the most significant findings I do want to highlight is that there were no increased risks of breast cancer in the estrogen group alone. And now, with all that in mind, The study created a misconception of estrogen being labeled as a carcinogen or cancer-causing hormone, stirring such an overwhelm of fear. That fear had led to millions of women underserved and deprived of long-term and life-changing benefits from estrogen. In essence, menopausal hormonal replacement therapy isn't just a treatment, it's a way to support preservation of function and overall well being. Now, for a little background, I want to reiterate that not all hormonal formulations are the same. This is very important. And so, for the two that I want to recognize that are available on the market today, for estrogen, we have the CE, which is primarily derived from pregnant horses' urine, which is very interesting if you hadn't already known that. And then we also have bioidentical estrogen, aka, not to be too technical, but it's 17 beta estradiol, and that's naturally derived from wild yams. So there's this analogy that I've read from Dr. Terry Denai. She has been well known within the realm of hormone replacement therapy and treating over 15,000 men and women. She uses this key and lock analogy. So think of hormones as the keys and the receptors as locks. I like to think of synthetic estrogen as the copied key. You know, it's made fit to match the lock. However, there are some edges that, aren't quite right. So then the lock doesn't always open as smoothly. Whether, on the other hand, there's bioidentical estrogen, and think of this as the master key, the original copy. It matches our body's natural chemical structure exactly and fits the lock just ever so effortlessly. And that also unlocks many of estrogen's benefits. Now, what are signs of low estrogen as women enter perimenopause and menopause? The ovaries gradually lose function and essentially retire. With fewer eggs released, there's irregular cycles, and estrogen, along with all other key hormones, decline. The hormonal drops also triggers this domino effect of symptoms, leading to night sweats, waking up in the wee hours of the night, hot flashes that won't go away. There's bone loss and osteoporosis, increased belly fat within the midsection, trouble focusing, and even anxiety that we see with these hormonal ups and downs, which cause mood swings. And there's also increased cardiovascular risk when we see the cholesterol levels raise in labs, as well as blood sugars that increase. And now for the most important part of the discussion, why does estrogen matter? As you see the benefits listed here, as much as I want to call it the miracle hormone, I've seen this help a lot of our patients here at Desert Wellness Center. I can surely attest that when a patient comes back to their follow-up appointments and after having hormonal replacement therapy on board, they feel like a whole new person. And so for women, estrogen is the most essential hormone for the body. It helps many people feeling like themselves and continue to feel their best. So I want to dive a little deeper into some of estrogen's benefits. Starting off with brain health, estrogen helps the networks in our brain talk to each other. So when we see estrogen get low, our neural pathways are weaker. There was an interesting brain study that I came across. And so they utilized PET scans of 54 healthy women ages 40 to 65 at different ranges um, and stages of perimenopause to menopause. So I had an image, but unfortunately, it won't be able to pop up here. It was a brain scan comparing the healthy woman's brain pre-menopause and then post-menopause. So if you can imagine a brain that is lighting up with some white spots. And from that study and these images that they found, the estrogen levels when dropped in menopause had an increase of estrogen receptor activity. This basically means that the brain is trying to hold on to as much estrogen as possible for what's available. And these densities or white matter areas that were shown into the scans, that significantly remained high in postmenopausal women up to their mid 60s compared to those in pre or perimenopause. So, with women having these higher densities or increased white matter, they often reported symptoms of brain fog, difficulty remembering small bits of information, and having trouble focusing. So, continuing on to brain health, maintaining estrogen is also crucial because there's this small center of our brain known as the hypothalamus. It's responsible for temperature regulation, and estrogen works in these thermoregulatory centers that keep our core temperature stable. Once perimenopause hits around the corner, the spontaneous hormonal fluctuations of estrogen, it confuses the brain, also increasing fight or flight, which then result into these hot flashes and night sweats. So maintaining estrogen is also crucial for bone remodeling, balancing bone breakdown, and bone formation. At 20 or at menopause, there's a 20% of bone loss or bone mineral density that happens. And then I've came across some evidence from the European Foundation of Osteoporosis and the NIH consensus that states that estrogen is the most well-established intervention to reduce osteoporosis related fractures from 30 to 50%, which is a big deal. And what's also interesting is that the WHI, the Women's Health Initiative, they found a 33% reduction in fractures with hormone estrogen therapy on board. And I listed a few fracture statistics just to bring awareness. With women, 70% of hip fractures will occur, and within 1 year, there's a 30% risk of them dying. And so in menopause or just women in their lifetime, 40% will experience osteoporosis. So the bottom line is that estrogen is a critical hormone for maintaining bone strength and preventing these fractures. In addition, with low estrogen, women find that their joints are, a little bit achy, feeling stiff, especially in their hands and knees. And so a lot of women that walk into our clinic, they'll often report symptoms of, foot pain, even shoulder pain. And the reason for that is because estrogen is important for the way that it reduces inflammation. It's the factor that signals the body to support collagen and elasticity in our joints and even our skin. Now, with estrogen playing an important role in many of our small blood vessels throughout the body, including those with the brain, skin, and especially the vagina. As estrogen levels decline, vaginal tissue becomes thinner, it's drier and more fragile, which is why women experience vaginal dryness, some irritation, even pain with sex. So, lower estrogen also increases the risk of urinary tract infections. And this happens because estrogen helps maintain the body's healthy vaginal microbiome and natural acidity. Without these, protective bacteria decrease, making infections, why does that sound weird? Infections more likely. Estrogen is just essential for keeping blood flow, um, and keeping tissues healthy, resilient, particularly in the vulva, vagina, and overall pelvic floor. And I also want to point out that vaginal estrogen is safe and does not travel systemically, or it's too low for the levels to appear to rise in labs. So when estrogen is locally replaced, it helps restore the vaginal health by normalizing the pH. It supports healthy bacteria, thickens the tissue, and improves lubrication. And it also reduces dryness in painful intercourse. But not only that, it supports urinary health by lowering the risk of UTIs and improving overactive bladder symptoms. There was a large study of over 5,000 women who were on vaginal estrogen, and the researchers found a 51% reduction in UTIs after starting the therapy. And before this, the women actually who were in the study, they used to have at least 4 UTIs per year. So although there aren't any long-term randomized trials evaluating the safety of low-dose vaginal estrogen, there is a long-term observational data that with women who averaged the use of up to 3 years had not shown any risk in breast cancer, endometrial cancer, coronary heart disease, stroke, or venous thromboembolism. Now, I made a list of bioidentical forms here. And so at Desert Wellness Center, we initiate estrogen replacement therapy using bioidentical hormones. These are designed to have less side effects than synthetic versions. And when regularly monitored and managed, they are far less likely to cause these side effects as well. So with these different applications and deliveries, these include creams, so topical or vaginal. There's troches, which are small lozenges that you dissolve under the tongue. Patches that get applied twice per week, and pellets. So with this slide, I'm going to talk mostly about pellets as it is uncommon, but the most effective method of hormone delivery I found is pellet therapy, especially when comparing labs. Estrogen as well as testosterone are available in pellet form. These are bioidentical and they look like little grains of rice. And so there are a few reasons why I find hormone pellets superior to other methods. Hormone pellets are absorbed steadily based on blood flow. So unlike injections, they often cause hormone peaks and lows. For example, testosterone shots that are done once weekly, the levels can spike right up and decrease quickly before the next dose. But I think for pellets, they're more, the levels are more stable from a day-to-day basis. Pellets also avoid common issues with other methods, such as bypassing the liver and removing the need for daily creams and patch applications. Pellets use a a slow release mechanism that steadily diffuses into the bloodstream and maintains balance levels. During increased activity like exercise or even times of stress, hormones will dump into the bloodstream and meet the body's demand. This delivery does include a small in house procedure. It takes around 15 minutes for women, sometimes less, but we perform that here in office. We'll inject some numbing and then make a small little incision, like yay big, um, and then pop these pellets right underneath the skin into the fatty tissue. So for women, it's particularly in the glute or the butt. And for men who receive testosterone, they have their procedure done right at their love handle and the side area. And once it's in, it will typically take up to 2 weeks for the hormones for you to start feeling full effects. But unlike other methods, you can feel the benefits last for 3 to 4 months for women and about 6 months for men. For the most important message of today, I want to say that aging is a natural process, and that should not mean settling for feeling unwell. Just as much as we use vitamins and minerals for our health, hormone therapy helps replace what the body needs to stay in balance. You deserve to feel strong, confident, and healthy at any age. So let's take this journey together and help you feel your best and get back right on track. So I'm going to wrap this up, but if you are wondering if estrogen is for you or have any questions you'd like me to answer, you can either put them down in the chat and we'll try our best to answer all of your questions. But feel free to contact me at info@desertwellness.com and or even call to book a consultation or with any of our other wonderful docs here at Desert Wellness Center so we can discuss your hormones. But I hope that you learned something new today, and I appreciate you all for attending and spending some time with me. Thank you for listening to our providers here, and have a great day.